The name Chikungunya fever is really a tongue twister. Look at this name. It doesn't sound like any disease we have in China. It actually used to be far from us, but for some reason, it suddenly took root and spread in our country. Essentially speaking, this is a viral disease. It's caused by a virus called the Chikungunya virus. It was first discovered in 1952 in Tanzania, Africa. So this virus has been around far longer than we imagined. The disease's name comes from the local Chikungunya language, meaning the person who bends over. Why is it called that? Because one of its typical symptoms is severe joint pain. Many people are in so much pain they can hardly walk steadily. They walk hunched over all day, like little old men. So you could say the name is quite fitting. The Chikungunya virus is mainly spread by mosquitoes, especially Aedes mosquitoes, including the notorious Aedes albopictus and Aedes aegypti. Most southern provinces and cities in China have these in summer. They usually bite during the day and are highly efficient at spreading disease. Once infected, people usually develop a fever, typically over 39 degrees Celsius, headaches and nausea, rash and muscle pain, and joint pain, the most typical symptom. Some people even develop chronic arthritis lasting for months. But the good news is, although it's painful, fatal cases are extremely rare. According to WHO data, the fatality rate is under 0.1%. Most people recover gradually in about a week. It's just that for the elderly, pregnant women, and people with chronic illnesses, it's a bit trickier. So how did the virus get in? According to official reports, the earliest cases were imported from abroad, meaning someone likely brought it back from the Indian Ocean region, such as Reunion, Mayotte, the Maldives, and so on. Then, since it was midsummer in Guangdong, hot and humid, with mosquitoes buzzing everywhere, it spread quickly. Let's review the timeline. On July 8th, Foshan reported the first imported case. On July 15th, Guangdong reported a total of 478 local cases. By July 20th, the number of cases had surged to 1,074. Most of them were concentrated in Shund. On July 25th, the number of cases exceeded 4,000. On July 26th, official reports showed a cumulative total of 4,824 confirmed cases. Of these, 3,224 had been released from isolation or recovered. No deaths were reported. In other words, it went from the first detected case to over 4,000 cases in just half a month. The reason Shund got hit so hard, on one hand, was due to the number of cases, and on the other hand, because it was just too suitable for the virus to survive and spread. What's Guangdong like in July? Daytime temperatures often soar above 35 degrees Celsius, and at night, mosquitoes are everywhere. Aedes mosquitoes love this kind of weather the most, breeding extremely fast. A small puddle can hatch hundreds of them. Also, Shund is a major manufacturing area in Guangdong, with large numbers of migrant workers gathered there, and densely packed residential areas. Once a mosquito bites an infected person, it can spread the virus through several cycles in a single day. What's more, many people initially thought it was just a cold or heat stroke, and went to clinics for drips, missing the best isolation period. By the time the health authorities realized the problem, the transmission chain had already spread. This disease is new in China, and most people have never had it, so they lack immunity. If the virus isn't contained now, there could be another wave before autumn arrives. Although Shund has already launched a full-scale mosquito eradication campaign, deploying over 7,000 mosquito-proof beds, and carrying out full-scale disinfection. Mosquitoes are such creatures that, as long as there's an undumped basin of water or a discarded flower pot, they can breed. In addition, there are reports that the epidemic is currently severe in the Indian Ocean region. Mayotte Island's infection rate is as high as over 30%. So, as long as international travel continues, there's always a chance the virus could return. So, under these circumstances, are we completely helpless? No. First of all, our government has acted quickly. Foshan has launched a week-long full-scale mosquito eradication campaign, clearing standing water in every village and spraying insecticide 3 times a day on key streets. Neighborhood committees are going door-to-door handing out mosquito coils, also distributing brochures. Medical resources are adequate. At present, all confirmed cases are mild. No deaths have occurred. All major hospitals have fever clinics. Community clinics are also equipped with rapid testing tools. This basically ensures early detection, early isolation coupled with growing public awareness. In the past few days, mosquito repellent in Foshan, floral water, and mosquito killer lamps have all sold out. Even mosquito nets have become best sellers. Many people are wearing long-sleeved clothing and using mosquito repellent patches. This shows everyone is on high alert, especially in cities like Guangzhou, Shenzhen, and others. They are even using drones to spray insecticide, with AI identifying areas of standing water and combining big data to track patient movement patterns. These prevention measures are far more efficient than before. In recent years, we Chinese haven't just been fighting viruses for a day or two. From SARS to COVID-19, from H7N9 to dengue fever, each one has given us a scare. But we've pulled through every time. This time, although Chikungunya fever came suddenly and spreads quickly, most cases are still mild for now. As long as everyone stays highly vigilant and takes mosquito eradication seriously, there's no problem in keeping it under control.